Hi and welcome to the DE Physical Education Flip Learning videos. For the sports injuries videos, I split this into three parts. Part 1, injury identification. Part 2, injury prevention. And Part 3, injury rehabilitation. Sports injuries can be caused by a fall, a heavy blow, failing to warm up properly, incorrectly, or using the correct technique, or simply by pushing yourself too hard. While injuries are not inevitable, it is very rare for someone involved in physical activity to remain injury-free throughout their life. There are two main types of sports injuries: acute and chronic injuries. Acute injuries occur suddenly during exercise, for example a sprain, and the pain is felt straight away. Chronic injuries occur after playing sport for a long time, often referred to as overuse injuries. Acute injuries. Any performer who experiences an acute injury can display the following signs: sudden or severe pain, swelling around the injured site, not being able to bear weight, restricted movement, and extreme leg or arm weakness. Or finally, a protruding bone or joint is visible or out of place. Potential acute sporting injuries: fractures, dislocations, strains, and sprains. A fracture. A fracture is a broken bone. There are two types of fractures: open and closed. A compound fracture, or open fracture, is where the bone penetrates the skin. A simple or a closed fracture is where the bone doesn't break the skin. Symptoms of a closed fracture include bruising, swelling, deformity, and pain, especially if you are trying to put any weight on the site of the injury and being able to move the affected body part. As a bone can break in more than one place or into different positions, there are many different subcategories of fractures. The 6 main subcategories are shown below. Commuted. The bone breaks into 3 or more pieces. Spiral. A winding break along the bone. Longitudinal. A break that occurs along the length of the bone. A buccal fracture. This occurs in children when the bone deforms but doesn't break. Hairline fracture. A partial fracture of the bone that is difficult to detect. And finally, a green stick fracture. This occurs in young children. The bone is partly fractured on one side but doesn't break completely. Dislocation. Bones are dislocated at a joint. It can be difficult to work out if a bone is broken or dislocated, so it's important to seek medical help at the earliest opportunity. Some symptoms of dislocation: deformity, swelling, bruising, numbness, pain, and especially if you try to put any weight on the site of the injury. Soft tissue injuries. These can be referred to as strains for muscles or specifically your tendons, tennis elbow, golfer's elbow, or abrasions. Soft tissue injuries are injuries to the muscles, ligaments, and tendons. A strain is when the connective tissue that attaches the muscle to the bone is stretched too much or tears. Some symptoms include pain, swelling, bruising, muscle spasms. Tennis elbow. This is an overuse injury caused by overusing the muscles and the tendons attached to your elbow, and is used to straighten your wrist. Some symptoms include pain on the outside of your upper forearm when flexing the forearm, and a pain gripping or swinging. This is not just associated with tennis injuries. Golfer's elbow. This is an overuse injury. However, unlike tennis elbow, this is when the pain is on the inside of your elbow, not the outside. And again, this is not just associated with golfer's injuries. Abrasions are caused when the layer of skin is rubbed off. Some symptoms include the area will feel hot, a burning sensation, the skin looks red or raw, or very little or no bleeding. Sprain. When the ligament that attaches the bone is stretched too much or tears. Some symptoms include swelling, bruising, numbness, pain especially if you try to put any weight on the site of the injury. Strain or a sprain. Remember, when it's a strain, it happens to the muscle, and when it's a sprain, it happens to the ligaments. Chronic injuries. Most chronic or overuse injuries display the following signs: pain when you compete or exercise, a dull ache when you rest, and swelling. 3 common chronic injuries: Achilles tendonitis, stress fractures, and tennis elbow. Achilles tendonitis. Tendons connect muscle to bone and are strong bands of soft tissue. When muscles contract, they help to move the bone and the joints. Tendonitis is an overuse injury that causes pain and inflammation of the tendon. The Achilles tendon is located at the back of the ankle and connects the heel bone to the gastrocnemius. Athletes who do a lot of running, jumping, or walking are prone to Achilles tendonitis. Stress fractures. A stress fracture is also known as an overuse injury where the area becomes tender and swollen. Stress fractures are most commonly found in weight-bearing bones, for example, the metacarpals. Stress fractures often occur when there is an increase to the amount of exercise or the intensity of the exercise is increased too quickly. It happens when the muscles become fatigued, so they are no longer able to absorb the shock of the exercise. The fatigued muscle eventually transfers the stress overload to the bone, and the result is a tiny crack called a stress fracture, as can be seen here. Tennis elbow. Tennis elbow is an overuse injury and occurs in the muscles attached to the elbow that are used to straighten the wrist. The muscles and the tendons become inflamed and tiny tears occur on the outside of the elbow. The area becomes very sore and tender. The medical term for tennis elbow is lateral epicondylitis. Any activity that takes place, repeated stress on the elbow can cause tennis elbow. It is often referred to as lateral epicondylitis because the end of the humerus is also called the lateral epicondyle. Therefore, epicondylitis. When the pain is on the inside of the elbow, this is referred to as golfer's elbow.